Hi, my name is Lauren Ramsos, and I am a junior currently enrolled in Sportsmed 3 with Mr. Tanasi at the South Lake Tahoe High School. For my injury prevention project, I decided to focus on the rotator cuff. One may ask, what is injury prevention? Injury prevention is an effort to prevent or reduce the severity of bodily injuries caused by external mechanisms such as accidents before they occur or events in sports that could cause an injury. I will be implementing certain exercises and stretches into my client's program in order to reduce the risk of injury to his rotator cuff during play. Throughout this program, I plan to conduct pre-testing to test how my client feels and how strong he is. Then I will build a program based on what I think my patient needs or wants to improve depending on his results. And then I will conduct post-testing to see how my patient has improved and how he liked the program. My athlete is Hector Davalos. He is a soccer player of 7 years and a baseball player of 3 years. He wants to improve his shoulder and rotator cuff strength in order to help prevent future possible injuries. The two main components that I'll be using to focus or that I'll be focusing on in my program for the rotator cuff are strengthening and flexibility. I will use strengthening exercises in order to strengthen their surrounding muscles, so if there is contact during his sport, he'll be less likely to have an injury, and I will then be implementing some stretches for his rotator cuff because it will also help prevent possible injuries like tears and sprains. For his initial testing, I had him do a pull up to see how difficult it was for him to do, and as you can see, it looked pretty easy. Then I did an internal shoulder strength test, and here it is again. And while I was conducting it, I did notice that it didn't seem as strong as his right hand. Um, I then had him do an abduction test, which went well, and an external rotation test, which he also seemed pretty strong. I did notice, so during his internal strength, it didn't feel as strong as the others, as I mentioned. So I made sure to implement strengthening exercises for that. And the rest of his tests did go pretty well, and he didn't feel any pain. For my program, I had him work out and stretch 4 times a week whenever he wanted to during the day. And I had him do a few stretches and then a few strengthening exercises with the band. And he would do 2 sets of 10 reps for each stretch and each exercise. So here you can see some of the exercises that I had him do: the cross over arm stretch, the doorway stretch, external rotation with band, internal rotation with band, and elbow raises with band stretches and strengthening exercises. Finally, for his post-testing, I conducted the tests that I did before, and his internal rotation felt much stronger to him, and his shoulder also was much more flexible than it initially started as, and he had a better range of motion. Overall, he felt a difference in strength since the 2 weeks ago when we started his program, and he said that after the 2 weeks, I felt like I was stronger and he might want to continue using these exercises to keep his shoulders strong.